My name is Daria Van Tyne, and I'm an assistant professor in the Division of Infectious Diseases at the University of Pittsburgh. Today, I'm going to tell you a little bit about the work in my lab centered on developing phage therapy for patients at Pitt and UPMC. So I'll start with a little bit of basics about phage therapy. So bacteriophages, or phages as we call them, are viruses of bacteria. You can see them here in this false colored micrograph. They're these little green spaceship looking things. And here they're sitting on top of a bacterial cell, and they're going to inject their DNA into the bacterial cell. They use the cell as a factory to make lots and lots of more phages, and the end result of that is eventual rupture or lysis of the bacteria. So we think of phages as little torpedoes or missiles that can be used to kill bacteria. We're interested in phages because increasing rates of antibiotic resistance have prompted an interest in phage therapy as a potential alternative to antibiotics. So when patients have drug-resistant or antibiotic-resistant infections and we don't have antibiotics available to give to them, we're thinking about phages as an alternative approach for treatment. So phage therapy is a highly experimental treatment. It's given right now on an individualized basis, but it's gaining some momentum and interest in both the medical and scientific communities. So phages have been used previously to successfully treat antibiotic-resistant infections, and phage therapy centers have been formed at several U.S. medical centers, and clinical trials to formally test the potential of phages for treating antibiotic-resistant infections have already been started. And so we're currently working to form a phage therapy center here at the University of Pittsburgh and the University of Pittsburgh Medical Center. So to tell you a little bit more about how phage therapy actually works, we first need to find some phages. And so in my lab, we isolate phages from environmental sources. So we have found that wastewater, either from municipal or hospital or agricultural sources, is a very rich environment to look for these phages in. So we collect water samples from the environments around our lab, and we process the samples. We remove the solids in them. We filter them to just get a fraction that contains phages, and then we screen those samples against bacterial isolates to see if we can identify active phages in them. So we do that to generate phages, and then we take bacterial isolates from an infected patient, and we screen those isolates against libraries of phages that we have developed. And we do this to try and identify phages that can kill the bacteria from the patient. So an example of that testing looks like this. So on this Petri dish, there are bacteria that have grown all the way across the dish. And these lighter dots here are places where phage have infected and killed the bacteria and prevented them from growing. And the single dots that you see down here towards the bottom of the dish, these are where one single phage has infected bacteria and replicated itself and then gone on to infect more and more bacteria, so that we can see what we call individual plaques here on the Petri dish. So we take either single phages or phage mixtures of different phages that are active against the bacterial isolate from the patient. We formulate them, we purify them and get them ready to give to the patient, and then we administer them in conjunction with our physician colleagues. After they get the phage, the patients are monitored for safety, efficacy, the development of phage resistance in their bacteria, or development of resistance on the host side through the production of phage neutralizing antibodies. So our experiences at Pitt and UPMC so far, so my lab is a research lab. We isolate and characterize these phages that can kill multi-drug resistant bacterial pathogens. We also receive periodic requests from physicians for phage screening of bacteria from patients that have antibiotic resistant infections. So we're starting to treat patients with phages on a highly individual basis. But one patient that we've treated recently who had a persistent and antibiotic resistant infection, when we gave them phage therapy, we were able to clear their infection. And this led to the patient being able to be discharged home and to continue their treatment on an outpatient basis, which was a favorable outcome. So our lab is part of the Pittsburgh Phage Project, and together with a bunch of other researchers and clinicians at the University of Pittsburgh, we're working to develop a phage therapy center at Pitt and UPMC. So if you're interested in learning more, I encourage you to check out the website of the Pittsburgh Phage Project. If you want to know more about my lab in particular, I invite you to follow us on Twitter or Instagram. Thanks.